And we've got some introductory slides that we just wanted to share with you all briefly before we turn it over to our speakers. All right, can you open that screen? Perfect. So welcome to the second day of the Falls Prevention Awareness Week Lunch and Learn webinar series. To kick things off, we'll begin with a brief introduction before handing the virtual stage over to our speakers from AARP. So to facilitate introductions and track attendance, please enter the following information in the chat: your name, organization, and if applicable, the number of people in your Zoom rooms. Yesterday, we had a few organizations that indicated that they have a few people in their watch party. So we would like to track that and make sure that we're engaging with you all as well. And some additional notes, please remember to keep your microphone on mute until the discussion Q&A portion begins, but feel free to use a chat for any questions that may arise during the presentation. Additionally, if this is your second day being a part of the watch party, we would greatly appreciate hearing how day one went. You could indicate that in the chat, email us, or let us know in the discussion thread in our Facebook. So the webinar series is a result of a collaborative effort between our North Carolina Falls Prevention Coalition at the statewide level, along with our 7 regional coalitions. For those of you who are joining us for the very first time, our mission at the coalition is to work towards reducing the number of injuries and deaths from falls among those adults in North Carolina. And to stay connected and receive ongoing updates, we encourage you to visit our Contact Us page on the North Carolina Falls Prevention Coalition website to receive ongoing updates through our listserv. The theme for Falls Prevention Awareness Week this year is From Awareness to Action. This theme signifies our commitment to moving beyond mere awareness to concrete, tangible actions. We aim to create real change in communities, ultimately improving the lives of older adults and adults with disabilities. So thank you all so much for joining us in this important endeavor to making a positive impact on falls prevention. The National Council on Aging has also identified 6 crucial steps to prevent a fall, and today's featured step is talking to family members. As a reminder, yesterday we covered the step of home safety assessment. If you missed it or would like to revisit the presentation, the slides have already been posted on our website. Additionally, we'll be posting recordings of all the sessions by the end of the week, so you will have the opportunity to catch up on any content you may have missed. And our coalition has actually devised a simple and memorable way of recalling the 6 steps through an acronym TEAM. Today, we're focusing on the letter T, which stands for Talk to Your Family and Friends. That will be discussed during the webinar. Remember, preventing falls truly is a team effort, and your involvement plays a crucial role in this collective endeavor. So before we dive into today's presentation, I'd like to highlight an insightful quote from the National Council on Aging. Family and friends can play an important role in keeping. They can support you for events in your life and can also help you be independent and safe from falls. So now I'm thrilled to introduce today's topic, which is going to be caring conversations discussing falls prevention with family through the Prepare to Care guide. Our speakers today are Rosalie from the AARP NC Wilmington and Coastal Region as the Associate State Director, as well as lead AARP Coastal Region volunteers, Barbara and Beth. They bring a wealth of knowledge and experience in the field of caregiving and falls prevention, among various other topics. So please join me in extending a warm welcome to our speakers, and I'll turn it over to.
Good afternoon, everyone. Thank you for having us. As Divya said, I'm Rosalie Calarco with AARP North Carolina, and I have 2 of my lead volunteers for caregiving, Barbara and Beth, with us to do our presentation today on caring conversations, discussing falls prevention with family, which is part of our Prepare to Care that we do with AARP for caregivers. Next slide, please. So caregiving may be one of the most important roles you will take on in your life. AARP's founder, Dr. Ethel Percy Andrus, was a caregiver for her parents. In fact, she left her job to care for her mother. She said, "It is only in the giving of oneself to others that we truly live." The human contribution is the essential ingredient. Dr. Andrus was an educator, and her passion was to help older Americans lead lives of independence, dignity, and purpose. She founded the National Retired Teachers Association in 1947 and later AARP in 1958, which Dr. Andrus's birthday would be the 21st, and it's the 65th anniversary of AARP. Caregiving is in AARP's DNA. AARP supports family caregivers and their loved ones both directly through programs and online resources, and more indirectly through state and federal advocacy. Next slide, please. So, how do you prepare for serious conversation? First and foremost, while we're talking about falls prevention, we want to have the facts. That's very important, but also maybe the facts about what could or could not be contributing to maybe your loved one potentially having falls. There's many things associated with that. Discuss your concerns with your healthcare provider. Obviously, if you're on medications that may contribute to dizziness or things that would cause you to be off balance. Investigate the alternatives, ways that might be help you with fall prevention. Talk to your family and be supportive. Obviously, when you are a caregiver wanting to talk to your loved one about falls prevention and or any nature of things, you want to be able to approach them in a supportive manner. And are there circumstances that create opportunities for conversation? So maybe they did go see their doctor, and this was a concern the doctor brought up that would allow you to have an opportunity to have this discussion about falls prevention. Next slide, please. Before you start the conversation, here are some things to consider. Look for an opening. When raising the topic of future care, you might find it helpful to reference an article you just read or something you saw on the news to break the ice. For example, I'm starting to think about estate planning. Do you have any advice? I just read an article about gathering important papers. Sometimes you show me where yours are and what you do in that case. And I will say that we do have some articles and resources that are specific to this topic of falls prevention. So that would be something you could easily say for this example. I just read an article about 10 ways to stay safe in your home. So try not to anticipate what your loved one might say or how they will react. Just get the conversation started. Be open, express your love and concern, and most importantly, listen. Keep in mind that the conversation will likely take place over time. Respect your loved one's wishes. Make sure your loved one is participating in the conversation as much as possible. It's important to center your caregiving plan on the wishes of the person receiving the care. Where do they want? Part of that is are prepared to care, where do you want to live? But, making sure that centering that around the topic of falls prevention, such as when you are having this conversation in their home, and maybe you are wanting to bring up areas of concern to you that might be could cause them harm to fall or whatnot. And then size up the situation. Once you get the conversation going, evaluate what you're hearing, understand your loved one's priorities in that as well, and then help determine the next steps. Next slide, please. So be considerate. Again, be mindful, be clear, recognize where your loved one may be in this conversation. Try maybe to pair this with a doctor's visit again if they've just recently been or there's been concerns about their medication. This is a great time to pair with that, and then be open to what and how your loved one may receive this information. Next slide.
So what we're going to do is look for team members who, first of all, live nearby. Proximity has its advantages, such as stopping over to see your loved one, driving her to a doctor's appointment, or cooking her a meal. Just because someone doesn't live nearby or have huge blocks of free time doesn't mean they can't pitch in. Family or friends living at a distance can help with tasks such as coordinating meals, bill paying, or financial assistance. Look for team members who can help with simple tasks. Don't be hesitant to ask others for help. Some people may need only a little encouragement to take on a task and are glad when you do ask for their help. And then look for team members who share their talents. So what you're going to want to do is leverage the talents and strengths of your team. For example, the computer whiz in the family, it could be a teenager, could set up an online calendar for coordinating meals or chores. And someone who loves to garden might be willing to help out with your loved one's yard. Your loved one can help identify team members as well, such as neighbors or friends from their faith community that you may not have even considered. While there may be one primary family caregiver, identify other family members, friends, and or neighbors who can check in or help with shopping and important errands. It's best if the person you're caring for doesn't leave their home and stays out of public places. Find out if services such as Meals on Wheels can help deliver meals, or if there are other local services to help with food or medication delivery. Next slide, please. Here are some more considerations about building and supporting your team. What you'll want to do is determine the number of team members. Both quantity and quality are important to think about when building your team. While having a large caregiving team can be helpful, too many people might be unwieldy to manage. So you want to make sure that everyone on the team is clear about their responsibilities. They should be supportive and willing to lend a hand to you and your loved one. The other thing is to assign roles and responsibilities. Everyone has something to contribute. So play to each person's strength and be clear on what's needed and expected. You also want to focus on the care recipient. The key participant in the conversation is the person who may need the care. So barring mental or physical capacity or incapacity or other extraordinary circumstances, the person receiving the care should play a significant role in determining who should be on the team and what needs to be done. Next slide, please. A family or team meeting is one way to help you get things organized and ensure all of your team members are on the same page when it comes to making and keeping to the plan. So first, meet with your caregiving team, and this may be face-to-face over a conference call or through a series of emails or texts even. Determine what works best for all of you and set up a system for future communications with the team. Next, you'll want to assess the goals and needs of your caregiving plan. Remember, this doesn't have to be extensive or fancy, as you can't anticipate every detail or scenario. Just try to include immediate needs and broader plans for the future. The AARP Caregiving Guide offers an assessment of goals and needs. You can see we have listed typical tasks in the areas of home maintenance, health, finances, transportation, and more. For example, if your loved one wants to move in the next year or so, you can assign someone the task of researching locations and facilities. After you determine your goals, delegate responsibilities. It's time to figure out who will do what. Make sure you determine what tasks everyone is comfortable performing. Be open to modifications as the situation and team members' ability to help may change. How your loved one's needs unfold may differ from what you expected. Next slide, please. The team member who will receive the care should play a significant role in talking about and assigning roles and tasks to the extent possible. For example, even if one child is an accountant, an older parent may feel more comfortable having another child look after their financial affairs. You're going to want to communicate. Try to keep everyone informed as things change. Make sure that everyone knows about the discussion ahead of time so there are no surprises or hurt feelings. One team member should take notes and write a brief summary of what was decided. A written summary of the plan helps ensure that the wishes and needs of your loved one have been considered and included. Next slide, please. There are many types of community resources that may be available to provide support. Your local agency on aging can help connect you to a variety of support services, such as home-delivered meals, transportation, adult daycare, care management, and more. Your local agency on aging also can answer questions about which resources are free and which may have a cost. You also can check into services offered in your community through the Elder Care Locator. It's a public service of the U.S. Administration on Aging. It connects caregivers to local services and supports. Any of the resources I mentioned today are in your caregiving guide available through AARP. Consult a professional. Oftentimes, your loved one's needs can be complex, especially when health, emotional, and financial issues are at play. A trained social worker or nurse can help you sort things out, determine what is needed, find services, and arrange care. Again, the Elder Care Locator is a great resource to find such professionals. Don't forget to ask your employer if they offer an employee assistance program. This also can connect you to professionals and other services in your community. Next slide, please. Teams often need outside support. Here are ideas about some of the most common needs. Number one, you can hire help. If you see your loved one's needs help with daily activities, try exploring home care options. Some home care workers do household tasks such as cleaning and meal preparation, while others do more personal care tasks such as bathing and dressing. Your local agency on aging can help you identify and connect with the appropriate services. Secure their safety. To help your loved ones be safe and comfortable in their home, try incorporating handrails, grab bars, night lights, or adjustable shower seats. Some things, such as installing grab bars, may be best left to a professional. You also can check out AARP's Home Fit Guide for a whole range of solutions as well. I encourage you to write down that website, aarp.org/homefit. The guide provides tips, suggestions, worksheets, and resources to make a home a lifelong home. You can explore housing options. A variety of housing with supportive services may be available in your community. Begin by making a list of criteria, such as location, group dining, laundry service, and more. Once you determine the criteria you need, visit several facilities and be sure to talk to residents and their families. Another helpful suggestion is support groups. They also can be helpful in navigating available resources. AARP has a Facebook group for caregivers, as well as online message boards on community to get connected to the online message group. Remember, the caregiving guide has many resources listed for your review at your convenience. For more information on housing options, go online and visit AARP's Caregiving Resource Center. The web address is on the back cover of your guidebook. If you're considering a nursing home, go to Medicare's Nursing Home Compare page at medicare.gov/nursing home compare for more information. Next slide, please.
Okay, thank you. The slide that's coming up now is a video of an opportunity that I had to be interviewed by WECT TV for its Home Fit segment that ran on weekends, mostly during the month of March and perhaps the beginning of April. I'm not sure we are having a little issue with it on Divya's side, pulling it up. Do you want for me to share my screen, hopefully, and that might.
Yes, we'll try that.
Let me see if I can share my screen. Okay. Let's see, where is it here? Let's try this one. Can everyone see my screen? That's the key. So let's see if we can play the video. So the video, as I said, is a home fit video, part of WECT TV's Home Fit segment. I was interviewed. There was a tour of my home to show that we, to the most part possible, have our home outfitted so that it's easy to navigate the halls, it's easy to see at night, and it's easy to just generally move around the house to prevent falls, to prevent people running into sharp edges, because a lot of the furniture has rounded edges. We have the rocket switches that, of course, are great for people who have issues with clicking the regular switch on and off, and you'll see much more. So let's see if I can get it started and you can see it.
Small changes,
Can you hear
ones too, can be put in place to accommodate those living in North Carolina. With our loved ones living longer and needing more care, many families struggle with the best way to help an aging relative. Barbara Akinwole with AARP North Carolina will explain to us how they can help with care at home. And we're inside now with Barbara. Barbara, it's nice to see you.
Thank you, Scott. It's good to have you here.
So explain to me, how does one prepare to become a caregiver?
Well, interesting that you should use two terms that are in a publication that we have called Prepare to Care.
Mm-hmm.
And in this publication, it has about 5 steps that one can begin to use. One, you plan. You have to have a plan in place because you have to know what you're going to do in different scenarios. You have to put together a team, a support team of friends and family, but you can also put together a support team of associations, whether they be civic or faith-based or other kinds of things. And then you have to put a plan in action to take care of yourself, because if you're not a healthy care giver, then the care receiver may suffer.
All right, let's get into the details. How do you make a home safe and fall-proof for an aging parent?
Well, Scott, that's a great question. First of all, in looking at walkways, you would make sure that they're all cleared. There's not a lot of clutter along the wall for them to bump into or anything. You would also put a non-skid material under any rugs that you might have, so there would be no slipping and falling there. You might also make sure that in darkened areas or corners, if they have to go around a corner or something, that there's lighting there that will help them sort of lead the way and keep them navigating in a better position than they would have been if it were dark.
So Barbara, let's talk about lighting. What are some techniques you can do inside and outside of your home to improve things?
Well, good lighting is very important for the safety of the caregiver and the care receiver. We have night lights on every wall in our house. They're motion censored. We have motion censored lights on our garage. And when we go out in the evenings, we make sure we turn on the porch light also, because that helps. We have motion censored lighting at the back of the house. And we have 2 designated lamps in our house that are on automatic timers. So they come on, say, like at 7 p.m. at night, and may not go off until like 7 a.m. the next morning. So that helps, especially when one might have to get up at night and go to the bathroom. But there again, our motion sensor night lights come in very handy, because as soon as you pass one, if it's dark in the room, the light comes on. So that's very helpful.
Excellent. And also easy to access switches inside the home.
Easy access switches also in the home. Once upon a time, they used to call them rocket switches. I'm not sure where that came from, because you could just flip it on with the backhand and flip it off. So those are quite convenient and easy to use.
Excellent. We're going to take a look at some other things outside of the home. So let's head outside.
Okay, sounds good.
So Barbara, now that we're outside, I wanted to talk a little bit about those everyday needs in your community. That's an important part of making a decision when
Absolutely.
taking care of yourself at home.
Well, we are very close to all of our everyday needs. We are within walking distance to our fitness center, our grocery stores, our drug stores or pharmacies. We have medical facilities. We have social outlets that we can go to. We also have restaurants. I want to make sure we mention those, because that's very important. And we are very fortunate in that I think we're probably maybe less than a mile for most things, which is a great walking, and it's for healthy living.
Yeah,
so that's very important to do that too.
All right, thank you very much.
You're quite welcome.
Subscribe to AARP North Carolina at aarp.org/family caregiving to get more information on home tips for your aging relative. There's also a free publication, AARP Home Fit Guide, that's available in several languages at aarp.org/homefit. That's aarp.org/homefit.
Okay, thank you for viewing that slide. Let's see if I can get that off. Okay, return to the desktop. So that was a great adventure for me, I must say, and I hope that that was helpful for you to see. Just as a wrap up, we want to look at 10 tips for making your home fall proof. You saw me talk about all of the items that I mentioned here, and they're very important, especially one called declutter. Now, AARP actually has series on decluttering, and I'm sure a number of other organizations have similar series, but that's an excellent one to watch. And any and everything we talk about here today can be found at, as Beth and Rosalie have already said, at aarp.org. You can type in /declutter, caregiving, fall prevention, a number of entities, and a collection of information sources will pop up for you. Next slide, please. And just as a final wrap up, what you use and what you need to make your house safe for those who may have physical issues or any other type of safety concerns. You don't have to spend a lot of money. There are a number of low-cost safety tips that you can put in place that will help you make your house falls prevention safe and just safe in general for loved ones and family and for yourself, for those of us who might have mobility issues. Next slide. And of course, we thank you for joining us here today to learn about what AARP has to share with the community when it comes to keeping ourselves safe from falling and any other type of physical situations that we may find ourselves in. Rosalie?
Thank you, Beth and Barbara. And we have allowed some time for questions if anyone does have questions. I know that we did provide Divya with our resources, so hopefully that you all will receive those as well, particularly the Home Fit Guide and some tip sheets that are available to kind of do an in-home assessment when you're looking at falls prevention. So we will allow for any questions that you all might have.
I don't think we have any questions, but we really wanted to say thank you all so much for presenting today and kicking our second day of the webinar off. We do have some conclusionary slides, so I'll pull that up in just a moment.
While Divya is pulling up the slides, I just wanted to add my thank you also to Rosalie, to Barbara, and to Beth. That was really helpful information. For folks who want to explore more resources, the National Council on Aging does have a handout for each of the 6 steps that we're going to be covering through our series this week and next Monday. And they do have a handout that is specific to this topic, 5 easy ways to talk to your family and friends. Divya did put a link to the article in the chat. And are there 2 articles, Divya, or just one? Just the one?
Yeah.
Okay, thanks. Okay, next slide, please. There are also additional resources that you can see on the screen. There are a number of different places online that you can go, including standingstrongnc.org, the website for the Falls Prevention Coalition for our state, which is ncfallsprevention.org, healthyagingnc.com, which is the Center for Health at the Center for Health and Wellness at UNC Asheville, where Divya and Ellen Bailey work. Also, the CDC has an entire grouping of resources under their STEADY initiative, which is all about falls prevention. And then the National Council on Aging does have numerous resources collected in Falls Prevention Awareness Week. There's a tab for that. Okay, next slide, please. Also, Falls Prevention Awareness Week acts as a catalyst. It's hopefully motivating individuals and communities to take those proactive steps that we need to do in order to prevent falls. By actively addressing this issue, we not only enhance the overall well-being of individuals, but also create a unified force for positive change. Together, we're hoping that all of our efforts can have a significant impact on falls prevention, as well as fostering safer environments and healthier lives for everyone. Next slide. For folks who are having a watch party either now or at another time, we do have a helpful discussion guide to get the conversation going and to probe into a couple of the different topics. And that is something that you can see here. And I'm not sure exactly, Divya, when did you send that out, or how are you sending that out to folks?
So it was already sent out through our listserv, but it's also posted on our Falls Prevention Awareness Week website. If you go where it says Falls Prevention Awareness Week 2023, you can see the discussion guides, and we have 4 to 5 questions per day.
Thanks, Divya, appreciate it. And then finally, join us tomorrow for another engaging webinar. Tomorrow, we're going to explore the benefits of Tai Chi for arthritis and falls prevention. Our speaker is Nicole Hagel, and she will be leading us through a series of movements designed to get us up and active. You can get ready to join, please get ready to join us tomorrow as we follow her expert instructions for improved health and mobility. And also don't miss out on the not only this session, but the rest of the sessions that we have throughout this week, as well as next Monday. We look forward to seeing you back tomorrow. And thank you for joining us today.